we're now going to turn to Laurelle Brown, thinking more about policy and systems change. Laurelle is founder and director of Laurelle Brown Training and Consultancy. A multidisciplinary team supports organizations to develop and embed equity and inclusion across practice, leadership, and systems for children and young people. She's also co-founding director of KIJ, I'm not sure I've got that right actually, Laurelle, but I think it's KIJLJI, is that right? Which is a membership organization for Black safeguarding professionals. And her fellowship in 2018 focused on foster care for adolescents with complex needs. So without any more ado, over to you, Laurelle.
Thank you, Carol. I am just going to share my screen. Bear with me. Okay, should be visible to you all. Yeah, great. Thank you very much. So, I am Laurelle. I'm director of Laurelle Brown Training Consultancy and co-founding director of Kijiji. And thank you, Carol. It's a Swahili word that means village. So there we go. Now I'm going to just spend a few minutes talking about the work that I do across those organisations, but I'm actually going to focus more on Laurelle Brown Training and Consultancy, and just give you an example or some examples of the type of systems change that we try and influence and contribute to. So just to set the scene, the context of a lot of our work, this is the current context, which I'm sure for most people watching, and obviously the panelists, is not going to be a surprise. We are working with clients who are still grappling with the impact of the pandemic, which we know has had a real detrimental impact on children, especially vulnerable children in the country. We've got local authorities that are experiencing high levels of deprivation in their areas, making big cuts, especially to early intervention across their services. The programs that we tend to try and collaborate with organisations, especially children's social care on, require change at lots of different levels. And what we know from the evidence about achieving change, impactful change, is that if you change one part of a system or a service, there is a need to also make changes in other areas. And obviously this is undermined and compromised when we are operating in such a complex and difficult time. We also rely on data in a lot of our work, and sadly a lot of the data that we need to understand some of our clients' context is not there, or it's held in silos, or it's fragmented. So this also poses a bit of a challenge for some of our work, and I'm going to talk about some of the work in a moment. We focus on inclusion in our work, as Carol just said. So for example, the type of inequalities or exclusion that we encounter: children from Black and some mixed ethnic groups more likely to be in care, or South Asian heritage less likely. We know in the profession, so as co-founder director of Kijiji, we undertook some research. We did a survey of Black safeguarding professionals. One of the themes was that 2 in 3 respondents feel that their ethnicity has resulted in barriers being imposed upon them in their career, and the majority of the respondents were social workers. And the final bullet point there, when we look at the leadership across systems in children's social care, so directors of children's services, which is there as DCS, we see that in the last return, DCSs tend to have been in the same local authority for about 30 months on average, and the average length of their time served as a DCS is now more than 4 years. So when we think about opportunities to achieve inclusion, more diversity at that level, there are challenges obviously when people are in roles for a long time, which on the one hand is fantastic because we need the stability and they often possess great expertise, but on the other hand poses problems when we're trying to drive change where we want to see greater equity and inclusion. So this is just setting the scene in terms of the context of some of my world and what I step into on a regular basis. So in our organisation at Laurelle Brown Training Consultancy, systems change, I'm going to focus on systems change in this talk. Systems change for us entails the development and reimagining and of 3 things really. We try and encourage what we would refer to as systemic thinking. So encouraging leaders and people working in services, whether that's children's social care or their partner organisations to think systemically, think holistically about the work that they do, the way in which things are connected in the lives of children and young people. We also then do work which focuses on the structures and the processes and the policies, the things that are in place that underpin those organisations and the work that then is done with children and young people. And we also often do work that tries to address the behaviours and attitudes of people within those structures and processes, which is a different form of systems change, but that informs things like the culture and the practice and the approaches, which is really important when we think about outcomes for children and young people. So I wanted to just clarify, I guess, the terminology. We talk about systems change quite a lot. There is abundance of research and theory around this terminology, but when I'm talking through how we do our work and what we're thinking of, this is it. We call our company LBTC. So the first example that I want to give is an anti-racist programme that we were commissioned to deliver in children's services. So I did my fellowship, it was focused on foster care. And what happened is when I came back, I was able to implement some of the things that I recognise as good practice in the role that I had at the time. But then as I progressed and I the company was already set up, but as the company grew and developed, we have started to work more on change at the organisational level and the leadership level, rather than the stuff I was doing in my role, which was great. I did have ownership of that, and we were able to achieve positive change with regards to placements and sufficiency and foster care. But now that's often one part of the work that I do with an organisation. So this organisation, they contacted us because they recognised that they didn't have a very diverse leadership team. They had a diverse social work team or equivalent roles, practitioner level roles. They had diversity there in terms of ethnicity, but things started to fade out the more the more senior the roles were. And in addition, they saw outcomes for Black children that were not equivalent to their peers across things like school exclusion and youth justice parts of the service. So they commissioned us to undertake an assessment of the service so that we could develop a report to guide the senior management about how they can approach this. They also wanted us to help build their knowledge and understanding of staff to an agreed baseline level. And they needed some consultancy support about how to approach this change journey, this change and transformation. Now, we did a report. We looked into different aspects of the service. We undertook staff surveys. We analysed policies. We analysed strategies. We analysed staff data. We interviewed some of their commissioned services. We interviewed parents and carers. So we did a holistic analysis of the service to try and understand what's going on when it comes to race and ethnicity. And we wrote a report, and we made 13 recommendations that were structured across 5 domains, which you'll see across that middle column: strategies, workforce and human resources, workforce development, commissioning, communication and engagement. So when we think about systems change, this is an example of what I mean. We couldn't recommend changes that needed to just be made across workforce development, because unless changes were made in commissioning or unless changes were made in human resource practices, the workforce development changes would be null and void. They wouldn't necessarily have a positive impact in terms of racial equity in that service. And something a bit more granular, an example of a recommendation was that they should develop a workforce development commissioning approach, because what was happening was they were commissioning services, they weren't QAing the content that the trainers were delivering to see if it was inclusive or EDI was covered in any way, given the diversity of children and young people that's worked with. They didn't have an approach which sought to ensure diversity of the trainers and the companies engaged. So they had quite a homogenous pool of people that had been in their commission services for a long time. And we also recommended that they explore and develop opportunities to consistently engage the third sector and parents and carers, because the third sector would say, we attend meetings, for example, strategy meetings with the local authority, the police and others, and we're the only people talking about racism, we're the only people challenging racism, and nothing's being done. And we're not being brought to the table when plans are being developed to address poor outcomes from racial disparities. So these are some of the recommendations that were made after this discovery phase. well, not myself, our project manager did a lessons learned with this organisation earlier on in the year. They've done a lot of work to try and act on the recommendations, and some of the impact that they shared in this meeting was that there's been a cultural shift in the service, and not just the family services department or children's services, actually corporately. This has triggered cultural shift corporately and some changes in how this is being approached corporately. There's a new workforce development strategy with racial equity or equality at the centre, and considerations around race and ethnicity. The social work practice model that's being used. So there was a lot of feedback in our report that actually you're applying a practice model which doesn't consider the experiences of individuals who have experienced racism, other forms of oppression and exclusion. And so the assumptions that you have around how this model will positively impact children and families do not consider the difference that in the lives and experiences of those from racially diverse backgrounds who are racialized in particular. So they've developed the practice model and the guidance around how this should be applied with those who come from racially minoritized backgrounds specifically. They've introduced some co-production approaches. They've revisited their training pool so that it's more diverse and there's new trainers, and there's a more rigorous approach to assuring training through the lens of equality, diversity and inclusion. And there's been investment in the leadership and the development of that leadership team so that they are able to practice cultural humility, understand anti-racism and drive that across the service. So systems change, you'll see these are just some things that have happened, but there's still a long way to go. And that's, I'm going to come on to the challenges. One of the challenges of systems change, it can take a lot of time, it takes a lot of capacity, and often in the services that we work with, if you think back to what I started with, there's not necessarily the sufficient capacity and time and headspace that is dedicated to this type of work. Trust is really important, especially when we're being commissioned on a work around race and ethnicity. People can be quite defensive when we feed back our findings, and there needs to be trust in the fact that it's well-intentioned and ultimately will improve outcomes for children and young people. That's the intention, certainly. Race and ethnicity and racism is a very touchy subject. People feel quite attacked often when they are hearing things that point to racism within their institutions and in themselves or the way that they behave. And leadership understanding of all of that is different. Some people have really good grip and are really open and willing to engage. Others can be at a different point in their journey. So this is an example of some of the systems change work that we've been doing. I'll just include another example before wrapping up, because I know we have just only a bit of time. So this was just a training piece. So we went into an organisation and they wanted us to do some training just to increase the capacity of their leadership to develop their own way forward when it came to inclusion across their system. So this is what we did. These are some of the topics that we had to cover: inclusive and conscious leadership, confident conversations, their practice model also. And on the right, this is what is called the systems iceberg. And this is, when we think about this in terms of theory of change, what we had planned should be able to be impacted by a greater level of knowledge and understanding by this group of leaders in children's services. Some of the challenges there, again, capacity, complexity, is to just deliver training and support people just from that perspective is quite a complex piece, change and transformation when it comes to inclusion. And so training isn't necessarily sufficient, but people are working with tight budgets and tight schedules. The operating environment is really complex. Often we need action learning because the evidence base is also developing around what's effective in this area, this type of systems change, inclusion. And so a short-term engagement doesn't necessarily speak to what we would want, but people are working within their means. So to conclude, my fellowship, at the time, I didn't realise that I would have the confidence to really run with my business and be able to use all of the learning from my career to really drive change across systems in this way. But it's really helped me to broaden my understanding, to connect with other people, to access funding, to support Kijiji, and to really just embark on some of these pieces of work across different types of systems in the children and young people sector.